College is a time where many young people choose to explore their newfound freedom, the freedom of living on your own, making all of your own decisions, and meeting new peers. Part of this newfound freedom can also involve engaging in potentially unsafe situations. I am also a student, so I know how easy it is to engage in these activities while in college, but I also know how important it is to stay safe. More than half the participants in a study done among college students believe they can tell if someone has an STD just by looking at them. Are you one of those students? Well, 80% of people who have an STD experience no noticeable symptoms. Let's imagine the scenario. You finally catch the eye of your secret crush on campus. You guys begin to talk, exchange numbers, and soon become an item. Now think back on when you guys first caught each other's eyes. Did it cross your mind to ask yourself, I wonder if he or she has an STD, or did it even come up in conversation? More than likely, the answer to both of these questions are no. When we first meet a person that we are attracted to, STDs are not priority in our minds because nothing about the person's appearance or dialect gives off the possibility of having an STD that will make it priority in our minds. Contrary to the beliefs of more than half of the students participating in the study, you cannot tell if a person has an STD just by looking at them. I will inform you about the prevalence of STDs on college campuses, the top 3 most common STDs on campus, and ways to keep yourself safe. According to the CDC, about 19 million new STDs occur each year, almost half among 15 through 24-year-olds. The CDC also reports that the most common on-campus STDs are HPV, chlamydia, and genital herpes. HPV is an infection that will cause genital warts, warts in the throat, and or cervical cancer. It is contracted through genital contact, most often during vaginal and anal sex. However, it can also be contracted through oral sex. Chlamydia is the most commonly reported STD in the United States. It is also known as a silent disease because it produces no symptoms in the majority of infected people. Chlamydia is caused by the bacterium Chlamydia trachomatis. Chlamydia can be transmitted during vaginal, anal, or oral sex. It can also be passed from an infected mother to her baby during vaginal childbirth. It is easy to cure but can impact a woman's ability to have children if left untreated. Finally, genital herpes has no cure, but treatment is available to reduce symptoms and decrease the risk of transmission. There are generally no signs, but when signs do occur, they typically appear as 1 or more blisters on or around the genitals or rectum. When the blisters break, they leave tender ulcers or sores. Most college students come in contact with these diseases due to a lack of responsibility, lack of knowledge, and having a false sense of security. According to the blog post on College Candy, 1 in 4 students currently have an STD. Women are 6 to 7 times more likely to acquire herpes than men are. Younger people are more vulnerable to chlamydia and HPV than older people. Western Herald reported that Americans under the age of 25 account for half of the 19 million sexually transmitted diseases that occur each year. College students represent the age group in this shocking statistic. Reality is that college students engage in sexual activity frequently. So as college students, it is important that we keep ourselves safe. Staying safe from STDs is fairly simple. Furthermore, it is vital to use protection or practice abstinence. A false sense of security can create long life health problems. Engaging in unsafe situations oftentimes create these lifelong problems for many college students. Remember, normally STDs produce no known symptoms. There is no way to protect yourself from someone just by looking at them.